Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, Brandi Glanville of the Real Housewives of Beverly Hills fame has finally beat her facial parasite. This is a wild one.
What?
And then, have we found a cure for pancreatic cancer? This has hit the news. It's all over social media. We're going to talk about it. And then finally, sadly, a UK mom has died after plastic surgery in Costa Rica. This is a really sad story. We're going to break down what happened. So I'm your host, plastic surgeon Dr. Bruce Hermann. And unfortunately, Kalee Dion Pear is out of town this week, but I have my good friend Rob, who's been on the show many times. Thanks,
Absolutely.
Rob.
I'm here to help.
Yeah, he's coming in to help break down these topics for me. In the box, we got Brenna. How are you, Brenna? You gonna help me carry Rob today?
Yes. Oops, I'm not centered. Good. How are y'all doing?
Good. You know.
Wait, you were gone last week, weren't you?
Yeah.
You on vacation?
Yeah, I was in Chicago.
For fun stuff or work?
Yeah, for fun. I went and saw Phantom of the Opera.
Oh, nice.
I was going to go to the Bulls game, but we didn't go because tickets were over $200.
Ouch.
And Derrick Rose retired his jersey number. So
Oh, cool.
it was an expensive game, but we got to watch it at a cool bar near. So
Nice.
And was it your birthday or did that already pass?
it was November.
Okay, I remember
Yes.
you left for your birthday. Okay, so sorry.
Yeah.
I will get down your birthday before the show is over.
It's like yesterday.
No worries.
At some point I'm going to get it down. Well, all right, cool. Well, all right, Brendan, we got to carry Robert because,
I need some help.
he's going to need some help.
Yep.
So,
Absolutely.
all right, Robert, you were asking me this. I'm going to ask Brendan. Brendan, what are the big reality shows right now? I'm not as huge into reality shows as I used to be. Is there any
I'm
big
the
ones?
perfect person for this.
Oh, okay. All right.
What do
Yeah.
you
Big
watch?
ones.
What do you watch?
I'm watching Traders right now.
Traders.
Yes.
Traders?
Yes.
That's
It's
a
like
reality show?
It's on Peacock.
Oh, I don't get Peacock.
It's
Yeah.
like they take people from other shows and they're on it. So like I really like Big Brother. That's my favorite
nice.
show.
Okay.
Yep.
Love Island is a huge one.
Yeah. Is the Real Housewives still on?
I think so, but I haven't really watched much of that.
Okay.
Yeah.
All right.
So one of the granddaddies, Survivor, right? Isn't it like 50th anniversary coming up? And they're bringing back
It
a bunch
can't be
of
the
old
50th year. Maybe the 50th episode.
50th season.
Yeah, maybe the 50th
Because
season.
like, yeah,
But what
that
do
would
they
be
do, 2 per
before.
year? So it'd be 25
I
years?
think so. Yeah.
Because I think Survivor started around 2000.
Yep. So
Yeah.
who knows?
That show's still on?
Absolutely. I guess so.
I very rarely watch network TV.
Yeah. Same to me.
Well, talking about reality TV, Real Housewives, I have to admit, I actually used to watch The Real Housewives of Beverly Hills, and then I watched a couple of the spinoffs, and then I kind of lost interest. But
Right.
But this first segment is actually about one of the Real Housewives of Beverly Hills, Brandi Glanville, who was on social media this past week talking about her facial parasite and how she apparently has beaten this.
Wow.
And I saw this and I was like, facial parasite. Okay, interesting. Gonna have to dig into this
Yeah.
because we don't get a lot of parasites in the United States in humans.
Yeah.
It's not common, but worldwide, it's kind of a big deal. And so anyway, so she's 53 years old. Brandi was posting, and she was actually thanking a Dr. Nikolai, who's a plastic surgeon out in Los Angeles somewhere. I've never
Right.
heard of him. But she was publicly thanking him for helping her get her appearance back.
Okay.
Because for the past year, she's been talking about this mystery illness that she's had, which has affected her face as well as some kind of just general symptoms she's had. And she was really frustrated because nobody could give her a diagnosis.
Right.
All right?
Right.
So she eventually came out and said that they thought she may have had a facial parasite. And I was like, okay, interesting. Because she did actually travel to Morocco for one of the Real Housewives reunions.
Of course.
And so I was like, okay, let's think about this from a scientific standpoint because she's never had a diagnosis made.
Right.
All right, so I'm like, okay, could she really have a facial parasite? And we'll throw that picture up in a minute, but not just yet. Is it possible she had a facial parasite from traveling to Morocco? So I thought that this was possible, but I had to actually do some research because I'm just not up to speed on my parasites.
So I was going to ask, what is a facial parasite? Like, I mean, because you think, like in Aliens, it lands on you or something like that.
Right, so there actually are a ton of parasites that can infect this skin.
Right.
But not all of them are in Morocco. Some are like, Southeast Asia, some are South Africa. Morocco, of course, is very North Africa, I think it's right on the Mediterranean if I remember correctly.
Yeah.
So I was like, all right, are there any what you would call cutaneous or skin parasites that are endemic to Morocco? And the answer is absolutely yes, there is.
Okay.
There's one called leishmaniasis, and when I saw the name, I was like, yeah, I remember that from medical school.
Right.
I've never diagnosed a case of leishmaniasis, although I do get skin stuff from time to time, so it's not out of the realm of possibility. But there is a parasite called leishmaniasis, and I actually have a picture that, throw the next picture up there, Brenna. It's going to have a picture. Yeah, okay, so the parasite's on the left.
Okay.
The little flagella-looking thingies.
Right.
And then on the right is a sandfly. And the sandflies are what transmit the parasites.
Through their larvae or their eggs or what?
I think that they're in their little, like the same way mosquitoes transmit malaria through the little biter part, the proboscis.
There you go, biter. I
think it's called a proboscis. Is that, Brendan,
exactly.
Can I get a fact check on proboscis? Is that the correct term for
I have no idea.
I'm sure it is.
Snout? I think it is.
I like biter.
Biter. Oh, that's kind of
But
lame.
I like that. It makes sense. Like the mosquito, because it'll have some leftover blood or whatever.
Right.
with,
So that's how these things get
or
passed around.
Ticks with Lyme disease and all of that
okay.
stuff.
So leishmaniasis is a thing, and it actually can infect the skin because some parasites, get into like your gut, like tapeworms. Like you're not gonna have tapeworms in your face.
Yeah.
But you can have leishmaniasis in your face.
Interesting.
And then the next question I have is, okay, we've established that there is possible that she could have gotten a facial parasite in Morocco. Is it possible that this went undiagnosed for however long it was, like a year? Okay.
How would you diagnose that?
Well,
how would you know?
If you're a doctor in Morocco, it's like top of your list when you see somebody with something on their skin.
Yeah.
But when you're in the United States, it's like not even at the bottom of the list. It's like on a piece of paper that's in a different room.
Yeah, I mean,
unless they happen to mention, hey, by the way, I just got back from Africa, and then you might think. So how could this all have played out? Well, there actually is a plausible way.
Okay.
If you get cutaneous leishmaniasis, it's going to make a wound on your face that's going to be like a non-healing ulcer. And I have a picture. Throw up the next one, Brent. I want people to see what leishmaniasis looked like in case they get it. So
interesting.
Obviously, that's not her. This is a patient, from some resource on the internet. Yeah, journal article or whatever. And if I saw that come in, I wouldn't necessarily think parasite. I would run the normal things that we think of in the United States. Things like skin cancers would be high on our list. Things like autoimmune diseases would be high on our list because these are things that we see. But I would not be thinking parasite. And so it's definitely possible that she could have had something like that on her skin, although there's no pictures.
Right.
She didn't post pictures of her with this thing on her skin. And she went to the doctors, and they just didn't think parasite because maybe she didn't mention that she was in Morocco or Africa or wherever.
Right.
And then what can happen is this thing can cause scarring on the inside. The body can clear the leishmaniasis on its own, and it actually does very commonly. If you know you have leishmaniasis, there's some very easy treatments you can take, but the body is actually pretty effective in clearing it. But the thing is once it's cleared, there's no kind of like after the fact test.
Yeah, how do you know?
Yeah, you don't know if you had it, right? So, okay, again, is this all plausible that she could have got a facial parasite? Yes. Is it possible that she could get back to the United States and have it be undiagnosed? Yes. Okay, now could it cause her to have the look that she did? So I'm going to throw that picture up, the next one, Brenna, that's her kind of like right in the middle of this. And so when I look at this picture, and of course I'm not like beating her up about her looks, we're just trying to kind of make a diagnosis here. I mean, she has a lot of atrophy of the adipose or the fat tissue in the cheek, like the cheek's really hollowed out. These kind of like indentations are indicative of scarring. And so
possibly that's maybe where it was or whatnot.
Right.
So let's just say,
Yeah.
she goes into the doctor, probably gets sent to a dermatologist, 1 or 2 or 10. What are they going to do?
I think it depends.
Put some cream on it. Let's see.
Are you talking about if she had a lesion?
Yeah,
they would probably biopsy it, but you have to be specifically looking for parasites, otherwise it'll get missed because we just don't test for parasites. We just don't have them here in the United States enough to, at least that type of like cutaneous stuff, to test for them. So, I mean, yeah, it's totally possible that it's theoretically possible that one, she could have had it, two, it could have been a misdiagnosis, and three, it's possible it could look like that. I mean, that would be a really severe case because that means that it didn't just affect the skin, it affected the soft tissue in her face, and it caused scarring and atrophy. And is all that possible? Yes, it's possible.
Right.
Now, is it likely? I don't think so. I mean, people have been weighing in on this, and so the way I see it, because I think about these things like, what would I do if I was a doctor? And as a plastic surgeon, I do see skin stuff.
Right.
And so if somebody comes in with some weird skin thing, I'm going to do the normal stuff. And if I still don't have an answer, then you start looking for zebras. And so what that means is...
the normal stuff, sorry to stop you.
Yeah, no, you're fine.
You're going to do like a biopsy.
A biopsy for skin cancer.
You'll check, yeah, right.
A culture, see if we can get a bacteria to grow off of it. Check for autoimmune stuff. Like the things that are the usual suspects.
Yeah.
But there's a saying in medicine that when you hear hoofbeats, it's usually a horse, not a zebra.
Interesting.
But sometimes it is a zebra. So if your first round of tests, don't turn up an answer, and this thing's not going away, then you're going to start to expand the search by saying things like, hey, have you traveled outside of the country? I mean, I like to think I'm a pretty sharp doctor, maybe slightly above average, but I think that any doctor is, if they can't get a diagnosis, is going to kind of go down that road of maybe this is something more rare.
Absolutely. I mean, that's on all of our forms now because of, the previous things and travel and everything else. And so, have you been outside of the country? Have you done this? Have you done any trips? It's like, yeah.
Right. It's like,
we see this all the time.
Africa. Oh, okay. So maybe we should test for weird stuff. Yeah.
Yeah, exactly.
So although I do think it's 100% possible that what she's thinking that she had a facial parasite, is it possible? Yes, it's possible. Is it likely? No, I don't think so. I mean, I don't know what she had. There were people saying that it was some aesthetic procedure gone awry, which is definitely possible as well. I mean, that's certainly on the table that, for example, if she'd gotten some sort of injectable filler that got infected, that would completely look like she looked on there.
Right.
Now, is that common? No, it's very, very rare, but is it possible? Sure.
So do you think it looked bilateral, on both sides?
No, it looked like one side looked worse to me.
Okay.
Which kind of makes more sense that...
That's more on the...
Well, I don't know, because, I mean, it would be unusual to get filler infected on both sides. So even if it was something aesthetic that went wrong, it certainly could be one-sided, unilateral, however you want to say it.
Right.
But yeah, and so, all right, well, they fixed her. I think she had a bunch of things. Throw up that last pic there, Brennan. This is her most recently at, I think, the Grammys or something. I can't, whatever was just happened. What happened, Brennan, last week? Was it the Grammys?
Oh, I can't remember, but I was going to say she is on Traitors that I'm watching right now.
Oh, she is?
Oh,
yeah,
nice.
But she's on season 1.
Oh,
and
okay.
because I just started it. There's 4 seasons. I don't know what year it is, but... I just made that connection. I was like, oh my gosh.
That's her.
I knew she looked familiar.
Yeah, how does she look? Does she look normal?
She looks normal, yeah. She looks like how she looks in that first photo.
Yeah, so.
Well, I think it's worth, I think it's for educational values, but okay, if she came into me with that picture that was like her with her face kind of, not looking so great, what would I do? Well, I mean, I'd want to restore the volume, do something like fat grafting to restore that volume, to kind of, pull out those areas that are kind of sunken in. And then it looks like she had, some cutaneous, irregularities. And I'd probably laser, her face.
Right.
And I mean, I think what she had was definitely fixable, and obviously it is because, I mean, she looks normal in the photo as far as she doesn't look like she's, been attacked by some facial parasite.
Well, and I guess maybe because it looked kind of, both sides of the face. There was
it looked like she had a lot going on.
But she could have lost a lot of weight or been sick.
It did look like she was very thin in that picture.
The Ozempic face, I don't know.
Again, I really don't think she had a facial parasite. It just doesn't click. Is it possible? Sure, but it just doesn't click for me.
Yeah.
And so, I don't think she's, trying to deceive people or whatever, but it's just, who knows what she had.
She looks great now.
Yeah, she got it fixed. I just feel bad. Apparently she was really, really in a bad way for a year.
Yeah.
spending money trying to figure this out and not getting any answers. And so, yeah, I mean, I definitely empathize with her.
Yeah, no, that's always the hardest part when you can't get an answer. What is this? We don't know. And so you just treat the symptoms. And so that does stink, but she's on the up and up.
She's on the up. She's on the rebound.
There you go.
All right. Hey, I'm going to recap this one, Brent. New horror unlocked. Facial parasites? No thanks. So, Brandi Glanville of The Real Housewives of Beverly Hills was on social media this past week thanking her plastic surgeon, Dr. Nikolai, for helping her get back on track. As she said, she's been battling a facial parasite for a year. Now, I was a little skeptical if she really had a facial parasite, so I did some digging. Is this possible? Yes, she was in Morocco, which does have cutaneous leishmaniasis, which is a facial parasite, or potentially could be on the face. It's a skin parasite. Could it have gone undiagnosed after she got back to the United States? Absolutely. We don't routinely check for parasites in the United States because they're not very prevalent here. So that is possible. And could it have made her look like she did when she was kind of in the middle of this mystery illness? Yes, it's possible. So is it possible she had a facial parasite? Absolutely. Do I think she had a facial parasite? I just don't. There's just some things that don't click. I really feel like if she had that parasite, even though it probably would have missed initially, I think most doctors would have been able to nail that down. Also, her symptoms were just a little different than what I think it would have given her. But yeah, I mean, I'll give her the benefit of the doubt. It's possible. She could have had a facial parasite, something crazy that I'm going to have to worry about. So yeah, I'm not going to be going to Morocco anytime soon. So I don't want to get that facial parasite.
Yeah, definitely.
Yeah.
I'll keep that off my list for sure.
Moving on. Now, I got a non-plastic surgery topic for you guys.
Okay.
You guys have probably seen this. I mean, and maybe this is because my social media trends medical because I follow medical people, but this story that we're about to talk about blew up on my social media over the past 2 days. So this is a segment about, is there a possible cure for pancreatic cancer? And that guy, that guy's like an all-star, Mariano Barbacid, that guy on the left. He's got like a port wine stain, which people were like, whoa, what's going on there? But this guy's like a cancer rock star, and I didn't really know who he was, but he's done a lot in the field of cancer. He's from Spain, so I just want to give him a shout out for this segment we're about to do. So, all right, do you guys know what the pancreas does?
It releases the enzymes.
Okay, good. Yeah, that's really, really good. That's
what he said.
That's basically it. Yeah.
It's all. That's where all the GLP-1s and all of that stuff happen.
Okay, that's the other thing.
Sugars
so, man, you're really good. All right, Rob, excellent. Good. Now you do have a medical background, so a little bit. Yeah. Okay.
I pay attention.
So the pancreas is this weird kind of fatty organ that does two important things. One, it releases digestive enzymes like amylase and lipase to break down foods. And then it also regulates our blood sugar through insulin and glucagon, which is GLP-1, right? All right, so it's a pretty important little organ, and I'm going to tell you guys right here now, if I could pick one cancer that I would never get in my lifetime, it would be pancreatic cancer.
It's tough.
This is bad stuff, man. It is, pancreatic cancer is the worst. I hated treating it when I was a general surgeon doing more kind of general oncology stuff. This is a really, really bad cancer, and I'll go into a little bit more detail about that. Also, I want to show you guys a pic of the pancreas. Throw that pic up there. It's the only pic on this segment, Brandon. Throw that up there. Yeah, that's the pancreas right there. And so just to give you guys some orientation, so the yellow thing is the pancreas. It's got like a head, a body, and a tail. It basically is attached to the duodenum, which is the first part of the small bowel, right underneath the stomach. You see the gallbladders there. You got the common bile duct, which is that green duct there, where basically the digestive enzymes get dumped into that, and it goes into your intestine. So that's your pancreas, and it's really kind of attached to some very critical structures. So when that thing gets cancer, it's like super bad news. It's different than I'm gonna throw a skin cancer where you can cut like a huge piece off, and it's like okay, you're gonna be fine.
Yeah, lung cancer, things like that. Treatable,
yeah, you can go without one lung, right, or one kidney, right?
Right.
And the pancreas, that thing gets cancer, man. It's rough stuff. So
yeah, so it's right above the belly, I guess.
Yeah, it's kind of right under your xiphoid or the bottom of your rib cage.
Yep.
So it's right here. Yeah. Okay. All right. So again, there was some breaking news on social media about the Spanish research team led by Dr. Mariano Barbacid, who again is a cancer rock star. He's done some other stuff. I can't remember exactly what he's done, but his name has been in the cancer journals a lot. So he basically used a triple drug therapy, and I was going to put the names of the drugs on there, but they're like super scientific names. It's not like, Pepsid. It's like RGB 46592 or whatever drugs, and there's 3 of them. They're using a triple drug therapy on mice that had pancreatic cancer or adenocarcinoma specifically, because, not to be too nerdy and stuff, there are some non-adenocarcinomas like insulinomas that are not quite as deadly as like the generic pancreatic cancer. But these mice had the bad one. This is the one you don't want to get. And the results were just like utterly amazing. I mean, almost to the point where like I'm a little skeptical. I mean, the results were so good. It eradicated the cancers, completely got rid of them, and then they followed the mice for an extended period of time, and the cancers didn't come back. I mean, you literally can't ask for better than that. Not to mention the mice didn't start, growing a second head because of the concoction of drugs that they were getting. So there was like very little side effects. So these results, and I wasn't alone. There were people on in the medical social media space who were like, "Is this real? Like, did this really happen?"
Yeah.
So really, just very great news on this animal model, because pancreatic cancer historically is very resistant to treatment.
Yeah.
There's a lot of reasons why pancreatic cancer is one of the absolute worst. One, because it's resistant to treatment. 2, because it's very commonly diagnosed late, because it's not something that causes pain. It just grows, and you just walk around.
You don't have a clue.
Not knowing you have cancer. Yeah. And then also too, again, the location. When that thing starts to get bigger, it's not just running into tissues that are non-critical. It's running into the stomach, the duodenum, the liver. I mean, things you don't want cancer on for sure. And so all of those factors result in making it one of the absolute deadly cancers. All right, so how bad is pancreatic cancer? Well, in the United States, it is, and this is for the United States, because cancers do vary a lot by country, like because of just regional effects, diets, hereditary things. Okay, so we're only talking the United States here. In the United States, it's the 3rd leading cause of cancer death, but it's only the 10th or 11th most common cancer. Which means it has a pretty high death rate, but really kind of a low incidence, which is bad, right? You'd rather something have a low death rate and a high incidence than it's like, okay, well, it's not. It's like skin cancer's got like an enormous incidence and a rock bottom death rate, right? Except for melanoma. So by the numbers, there's 67,000 new cases of pancreatic cancer. That's actually a lot. I didn't realize it was quite that high. That's annually in the United States. And there's about 52,000 deaths every year. And if you look at the 5-year survival rate, which is, so when you talk about cancers, and hopefully none of, Rob, Brandi, you guys never have to worry about this, but if you ever get a cancer, one of the things that's important to know is like, what is the 5-year survival rate? Because that's the metric doctors use to determine, is this cancer bad or not so bad, right? So like a 5-year survival rate of like 90, 95%, you're good. That's good.
Absolutely.
Pancreatic cancer has a 5-year survival rate around 10%, which means at diagnosis, 90% of people will be dead within 5 years. And the majority are usually dead within a year. Like, it's bad stuff. So really excited to hear about this new research that came out. Now, is this a cure? It's not a cure because it's an animal model. Now, that's a lot better than some research. You see a lot of people pushing these news articles about, new research shows X, Y, or Z, and it's like test tube. It's like they put a cancer cell in a test tube, and then they put a drug on it, and the cancer cell dies, and it's like, okay, but like that's not.
Well, that's where you start.
That's where you start, right? Okay, it's a start.
And
yes,
then now,
it's a start.
So let me ask this, a little bit of a nerdy drug question. So did these drugs already exist? And he's...
Dude, that is a great question. And I actually...
He's a mixologist and figuring that out? Because that happens sometimes too.
I think a lot of them are experimental drugs because they don't have names. They literally have like number designations. And I didn't recognize anything about any... That's why I didn't even include it, because I didn't want to be like, oh yeah, this new drug, R2D2 C3PO or whatever, right? I was like, it was literally like that kind of like name, and I was like, well, no one's gonna. know what that is. So I think these are experimental drugs.
Okay.
But the one thing that he did mention, and this he's pretty sharp. So he says that he thinks one of the reasons that pancreatic cancer regimens fail is because they're usually like monotherapy. It's like one drug. So this is 3, and they all work at different points to basically knock out the cancer's ability to replicate. Okay. So it's not like they're all trying to knock down the front door. One's going in the front door, one's going in the back door, one's coming through the window. And it's like, whoa, the cancer like doesn't know what to do. It's tagged and bagged, it's gone, right?
Yeah, there you go.
So, I mean, it's a pretty smart way to go about this. And again, also fortunate that the mice weren't, dropping dead from the crazy concoction of drugs.
Yeah, absolutely, because you never know how much is too much. And
so
so
what happens
that'll be exciting to see.
Right, what happens from here? Well, they're going to have to do the protocols and get funding for human trials. Unfortunately, or fortunately, depending on how you look at it, the wheels of medical research turn slow. I say I did medical research. I did medical research because I was required to do medical research at like all of my training programs.
Right.
It's not my bag, baby. Like, I'm not the research guy. Like, I don't. It's just not. It's not my thing.
You don't want to write the white paper. Well, so hopefully next steps they can start.
Yeah.
I mean,
trials.
Not tomorrow, but
I'm
soon
hoping within
figure out
a year or two.
Yeah. Let's figure out what what the right dose is on some humans, and if it's pancreatic cancer and it goes quickly, then sometimes that's the thing with some of those. It's like it's
some of those
trial.
trials. Yeah.
Who's going to sign up for
I think anybody would sign up because I mean, if you have pancreatic cancer, man, you're like looking for that Hail Mary.
Yeah.
You don't got a lot of time generally to wait around.
And I don't mean this light, but what do you have to lose? You don't have much to lose.
Yes, I agree.
At that point, we're not talking about another GLP-1 speaking into the pancreas and lose weight and all of this stuff and side effects. And of course there's side effects, but at that point, what
do you got to lose?
Try anything. So that's exciting to hear.
I think it's super exciting news because, it's just one of those things that I just specifically remember when I was a general surgeon and doing surgical oncology. It's like, I was like, man, I hate pancreas cancer. This is bad. Like, I just don't like it at all. I mean, not that I like any cancer, but I really don't like this one.
Well, because
double thumbs down.
Yeah, chemo, I guess, doesn't
really do anything. Yeah. Like the only way, at least, and I'm going to say this, and some oncologists will probably pick me apart, which is fine. I don't care. But like, just a kind of a general rule with pancreas cancer is like, if you don't catch it when it's small enough that you can resect it, like you're in bad trouble. Like you're probably going to die really quickly.
Yeah,
Now, is that 100% true? No, I mean, it's not. But I just remember seeing when I was doing surgical oncology, it's like, if we caught it when it was really small, and we could do like a pancreatic head resection and then reattach like all of the ducts, which is called a Whipple procedure, which I didn't like because it was just like so tedious. But if you could do that, you could save someone's life.
Yeah.
But if you didn't catch it early enough, like it was just it's like basically throwing a cup of water on a building fire.
So just putting this in perspective for everybody else, so you've been in there and seen something like that.
Yeah, for sure.
Like cancer,
yeah,
I guess.
For sure. Yeah, I was a general surgeon before.
When you did general
plastics.
surgery.
Yeah, and where I did my general surgery, and even kind of like the time when I did it, like there were not near as many specialists.
Right.
We didn't have trauma surgeons. Like just general surgeons were trauma surgeons. Laparoscopy surgeons were just becoming a thing.
Right.
And in fact, the program I went to prided itself on it didn't have fellows, meaning nowadays, if you're like a general surgery resident, you don't get to do as many cases because every place has fellows, and the fellows are doing the really cool cases. Was not the way it was when I was in training. So like I was doing Whipple. I've done Whipples myself, which is basically the pancreatico duodenectomy, which is basically pancreas, duodenum.
Because you had to do everything.
Because we had to do liver
surgeon.
resections, liver transplants, kidney transplants. I mean, I've done basically everything but brain surgery.
Right.
Did cardiac stuff. I mean, we used to do like our own sternal, like we wouldn't consult cardiothoracic if someone got shot in the heart. We would just open the chest up and, find the heart, fix the hole. And I mean, we had some cool, I remember doing some cool saves. There was a guy that got stabbed straight through the heart. Wow. And just me, and another resident with no tending opened him up and fixed the heart and closed him back up, and he did fine. But it's a different time, right? I mean, that may sound crazy, but we didn't even have attendings in-house, for a level 1 trauma center, like the residents were on service.
Right, and what do? Wait for somebody? I mean,
Now, times are different, but, I mean, that's a whole nother conversation.
Right.
So
I have a question.
Yo, dude, bring it, Brent. I've been waiting for you to ask a question.
I don't know if you already said this, but is it more common in men or women to get pancreatic cancer?
I think pancreatic.
Or what's like the age range for it too?
Yeah, that's really good. And I'm going to go from memory here, so don't 100% quote me on this, but if I remember correctly, pancreatic cancer is more common in men, and it's definitely a disease of older people. Like, you generally don't see young people getting pancreatic cancer, with the exception being things like insulinomas, which are not near as deadly.
Right.
Like, you can get like the islet cell tumors of the pancreas when you're young, but the pancreatic adenocarcinoma, which is the super bad one, is a disease of older people. Like, I think the average age of onset's like mid to late 60s, maybe even early 70s.
Right.
But the reason it's bad is because it's basically asymptomatic up until the point that the cancer starts pressing against the common bile duct, and then you get basically a buildup of bilirubin, and you get jaundice.
Right.
Painless jaundice. We used to have this saying when I was a general surgeon that painless jaundice is pancreatic cancer until proven otherwise.
But it could happen really to men, women. There's no.
I think it does have a male prevalence, and it's definitely a disease of older people. I mean, you'll see the occasional 50-year-old catch pancreatic cancer, not catch it, but come down with it.
And it's not because of their lifestyle or
I think
probably
I do think that like there are some risk factors. I think like heavy drinking is one, if I remember correctly.
Maybe smoking.
Smoking's definitely one. Yeah, that's one, Brenna. Yeah, but I mean, it's not one of those things like lung cancer where it's just so closely tied to one risk factor. I mean, most people that got pancreatic cancer that I remember were just like normal people that lived a normal life, and it's just like it's the bad luck of the draw. So
that's so sad. Yeah, I had a friend that had her gallbladder removed. So I wonder
if
she
have gallbladder cancer? No,
I don't think so, but she had that.
Dude, gallbladder
removed.
surgery is super common.
Yeah.
I used to say
does that affect that? Like if you get your gallbladder removed?
Like the gallbladder just stores bile. You can go without it. It's totally fine. Yeah, you can totally go without it. So
I didn't know so. I guess I haven't really looked at a diagram, but it's like so close to it.
It is. Yeah. Go back to that picture. So there's the gallbladder right there. You can see it. Yeah.
Crazy.
Yeah, it's right there on top of it. Yeah, I've taken out 1 million gallbladders too.
There you go.
Yeah. All right, let me recap this one, Brenna. Wow, some super exciting news out of Spain where a cancer rock star, I don't want to mess his name up here. I got to look it up. Dr. Mariano Barbacid, who is a cancer rock star. He's been in a lot of papers treating cancer. Came out with some great new research that there may be on the horizon a cure for pancreatic cancer, which is a bad one. Now, you may ask, what does the pancreas even do? I've never even heard of this organ. Yeah, it's kind of a lesser known organ. It actually releases digestive enzymes and also controls your blood sugar through the release of insulin and glucagon. And I was just telling the guys on the show here that there's one cancer I don't want to get. It is pancreatic cancer because it is extremely deadly. It is the 3rd leading cause of cancer death in the United States, despite being just the 10th or 11th most common cancer. So this stuff is bad. 5-year survival rate, only 10%. Don't want to get this. However, there is new treatment out of Spain in mice, not humans, but a good start, that a triple drug cocktail completely eliminated the pancreatic cancer and there were no recurrences. Results that are almost unbelievable, but because they come from such a cancer rock star, we think that they're real. So what happens from here? The cure's not here yet. It'll have to go from animal trials to human trials. Hopefully we'll see the same great results, and maybe this really terrible cancer is on the way out. Bye, pancreas cancer.
Yes, bye. Bye all cancers.
Yeah. Okay, all right. Last one.
Yeah, what else?
This is a sad one. I hate reporting on these because it's just, I hate talking about when bad things happen to people, but there's things to be learned from it, and that's why we do it. So
there you go.
Yeah. So it's a really sad story that unfortunately is a recurrent theme on the show. This is about a UK mom who died after plastic surgery while in Costa Rica. Yeah, so this is a 45-year-old woman named Regina Kerr, who is a UK citizen. It didn't say if she's from England or Scotland, or UK is like all of them, right? Like that's Wales, Scotland. Is
Sure.
that Ireland too?
Yes. Why not?
Okay.
I
just know UK
I have
is
some
like
friends
all
that are
of it.
going to call me. But
I know it's
yes.
all of it because I figured if
There
she
you
was
go.
British, they would have said British, but I don't know.
Yeah.
All right, she's
Yeah.
from the UK. All right. Maybe some European people can like clue me in on that. All right, so she's from the UK. She's living in Costa Rica where she's a teacher. She's at a bilingual school where she's teaching English to, they speak Spanish in Costa Rica from what I understand. And unfortunately, she passed away last week. And this was one day after getting plastic surgery. Now,
Wow.
You said last week?
yeah, it's just happened.
Oh my
Literally,
goodness.
This literally just happened, like less than a week ago. So reportedly she had liposuction of her arms, a tummy tuck, and fat grafting, okay? All right, so we gotta remember those three things. Other details are pretty sparse. There was no basically explanation of the cause of death, just that she had a medical emergency at a aesthetic clinic is how they termed it. We'll come back to that. Was transferred to the hospital and she unfortunately passed away. All right, so what could have happened to this poor lady? Because, I mean, I do think it's important that people understand what the risks are because, again, this is a recurrent theme on the show where people are going out of the country, they're having certain types of operations, and they're either getting killed or maimed or botched or however you want to talk about it. So what are the possible causes? Well, it said she had fat grafting. And so if she had fat grafting, there's a very high possibility. I'm gonna quiz you, Brenna, and if you don't get it right, don't feel bad because you're still pretty new. If she had fat grafting, what maybe did she have?
Wait, what? Repeat the second part?
If she had fat grafting, what surgery that I don't like did she maybe have?
Oh,
It's okay if you don't know. Just be like, I'm not 100%
I'm
sure.
blanking. Like I've heard
Starts
this.
with a B,
Oh, Robert
ends
knows
with
it.
an L.
BBL.
That's right.
Okay.
Yeah, very good. I'm not putting you on the spot. I felt like
I was
felt
thinking
you
that
were-
I was like, I feel like that'd be too obvious. But then, yeah. I can't second guess myself.
That's right. So yeah,
know
so
what's
if she
up.
had fat grafting, realistically, that's one of three operations. Most likely, it's a Brazilian butt lift, which I absolutely hate these surgeries. I will not do them. I even will talk down to surgeons that do them openly. So it's either Brazilian butt lift. It could have been fat grafting the breast. That's a possibility. Okay, it's possible. It could have been fat grafting in the face. That's also a thing.
Right.
Most likely Brazilian butt lift. Okay, so if she had a Brazilian butt lift, then the potential cause of her medical emergency is most likely fat embolism, which is the reason the mortality rate of Brazilian butt lifts are so high. So what that is fat grafting. For those who are not familiar, you harvest fat via liposuction. Typically you process it, make it a little bit more easy to inject. Then you inject it into another area. Fat embolism is when that fat gets injected not into other fat tissue where it's supposed to go, but gets injected into a blood vessel. And if you get fat globules in a blood vessel, that is a medical emergency that 100% can kill you. And that is the most common cause of death after Brazilian butt lift, and it's actually not very low.
So basically what you do, or what one does, not you, with a fat graft or... So do you do any fat grafts? Okay.
I'll do breast and I'll do face.
Yeah,
and so ask me, why do I do that and not the butt?
It's safer.
Yeah, I mean, it is. Like the issue with the butt...
Results.
The issue with the butt, I mean, there's more than one issue, but the reason that the fat embolism ratio risk is so high with Brazilian butt lift is there's a lot bigger blood vessels in the butt. I mean, that's the bottom line. There's some huge blood vessels in there. You're using a cannula that's, I use a Coleman injector, which is probably, I mean, you guys probably can't see this on the camera. It's probably like an 1/18 of an inch. It's about the size of an 18 gauge needle, which is what that means, an 1/18 of an inch, except it's blunt. But, there's blood vessels big enough that especially if you're not using good technique, which, man, I hate to say this because it's going to come off bad, but I'm going to say it anyway, that I think a lot of really high quality surgeons are not doing Brazilian butt lifts, if that makes sense, which means maybe
it does make sense.
The ones that are doing it are maybe not as technically skilled.
Well, follow the money.
I mean, there's a lot of people that don't do them. There's a lot of, and some people don't want to talk about it. Like there are plastic surgeons like, I don't want to weigh in. I mean, I'll weigh in. Like I think it's a bad surgery. I think if you're doing them, if you're really skilled, you'll probably be fine. But there's always that risk, right?
Absolutely.
And there's other issues. It's not just the death. I mean, to me, that's the big one. But there's other downsides to it. And so all of it together, I don't like them. And I really derailed my own conversation. What was I talking about?
So how it happens? So you go take take the fat, you process it, and then you're re-injecting it.
Yeah.
So the other thing, I mean, this is just common sense for me. Yeah, if you're doing it in the face or the breast, and versus my butt is a lot bigger than anything else, and I'm not getting any of those. Mine, obviously.
That's a secondary reason I like it, is because you need so much fat. Yeah, you're doing a lot more. Yeah,
so 100%. The more you do, the more risk.
The more risk. Yeah, 100%.
Yeah. So that
bigger
makes
blood
sense.
vessels, more injection. True. I actually like it for the breast, and I've done a lot more fat transfers to the breast. But like for breast, I might inject. I think the last one I did, I injected like 120 cc's per side.
Yeah.
It's not a lot. For butt, you're generally trying to inject, 500, 750, 1,000.
So you're doing like 4 times as much?
Least. Yeah, you're doing a lot more.
5 times as much.
Yeah. A lot.
More risk.
So anyway, fat embolism, definitely high up on the list. Without question, the most likely culprit. All right, what's another potential culprit? Well, I think second on the list would be an anesthetic complication. And that could be one of 2 things. If they did this in like an office clinic, it is possible she had this done under local anesthesia, and it is not uncommon for people who get large surgeries under local anesthesia to get lidocaine toxicity, which will cause you to go into cardiac arrest. I'd say we do probably 2 or 3 stories a year on the show, just in the United States, about people who died from local anesthetic toxicity, and there's probably plenty that we miss.
Time out. Let's go back to doing just the face or breast. Can you do those local? How do you typically do them?
So I will do minor procedures under local, but they have to be minor, like really minor. The biggest thing I'll do in the office under local is like what I call spot lipo. So spot lipo is not, I want to lipo my whole stomach and my hips and all this.
Right,
it's like I got one small area that bugs me, that's really a small area, maybe something the size of my palm.
Okay.
And if it's that small, and if I think the patient can tolerate getting the injections, it's not unsafe to do lipo in the office, but it does open up like a whole new can of worms. Things like you have to be super cognizant about how much anesthetic you're giving. And so I usually will only do like less than 50% of like what's considered like a max dose.
Right.
Like way so far under it that like I don't have any like concerns about where.
So if you're somewhere and they're going, yeah, sure, we can do that in the office, no big deal.
It just depends on what it is.
Those should be red flags.
If it's a scar revision or something small, sure.
Okay.
If it's real surgery that they're wanting to do under local, then you should run away. It's like, why are they doing it like that? Is it because they can't get an anesthesiologist to work with them? Maybe. I mean,
because in a surgery center, you would have that anesthesiologist.
Yeah, typically you can do local anesthetic in a surgery center.
Right.
But yeah, it is a red flag. Doing large surgery under local anesthesia is a super bad idea. Go back to the liposuction. For example, if I'm doing, and this is the third potential complication that I'm going to combine into what we're talking about now. If I'm doing liposuction of the abdomen, I don't want people tensing up where they're, like if you tense up, like in your abdominal wall, like bulges forward, like you can literally punch right through it. And so what happens when you're doing things under local, it's like, oh, okay, they're numb here, and then you get to a spot where they're not numb, and then they jump while you're jabbing them with a metal rod.
It's happened to me, like with the dentist, and he's like, ooh, hold on, let me give you a little bit more.
Exactly right.
So, you just wince, but
you're moving when someone is like doing something that's potentially dangerous around you.
Absolutely.
So, and I've had that happen, even just doing spot lipo where somebody jumped. I'm like, whoa, okay, sorry about that, but we got to numb you up. We can't have you moving. Like it's making this less safe, right?
Absolutely.
So, and that's when I'm doing something tiny. When you're doing a big surgery, these guys are crazy. They're absolutely crazy. There's just no reason to put someone under that risk. Like you can't tell me that the risk is less to do it under local. It is more. There is risk from general surgery, but like nowadays that risk is like the same as if you're driving from your house to the surgery center.
Well, and
is there a risk of driving and getting in a car crash? Sure, but it's like nothing.
And I've seen some of those TV shows where they investigate this, and some of these doctors that are working out of a center are doing,
tummy tucks under local or something
and
stupid.
15 hours of surgery that,
Yeah. Oh, it's absolutely
this
bonkers.
takes 8 hours, this one so he did how many?
Yeah.
Oh, well, somebody else is doing that that's not
trained.
And
the research clearly shows that the mortality rate starts to jump up the more surgeries you add on, specifically for aesthetic stuff.
Yeah.
Again, I think that's a self-limiting kind of data point because like I put a hard cap on like 2 procedures. You want your tummy done, you want your breast done, fine. You want your tummy's breast and arm? No way. Like, I'm not doing it. Like, I don't care how much money you offer me. I'm not going to do that. Like, it's just too much. It's not safe. It opens up more risk, and I'm not going to do it. Whereas other people are like, yeah, sure, I'll take your money. Why not?
Yeah, it's like the mechanic. No, we need to wait on that one. So you're saying you would do maybe 2 things
two
at
things.
a time.
At a time.
So
and
they
then
would
I
come
literally
back
make people
maybe
wait. Like, I tell
3
people,
months, 6 months.
it depends on what they're having done, but like, it's like say someone did like, and I have this happen all the time where I come in and somebody's like, look, I want to do my arm, like say they had a lot of weight loss. Like I want to do my arms, I want to do my thighs, I want to do my tummy, I want to do my breasts.
Let's get it all done at once. Makes sense.
Like, absolutely no. It's like you can pick 2, pick your favorite 2, we'll do that. Then we're gonna wait at least a couple months for you to completely heal up, make sure you're doing great, and then you can jump back in if you want. And people do it because I'm like, look, I'm not gonna do all this at once because it's not safe. And people like that because they know that I'm like basically turning down money, right? I'm like, look, I'm not gonna do that, right?
Good.
So so anesthetic the other one I kind of said I was gonna mention, I didn't, but is like the perforation. Like there are documented cases, even within the United States, of people doing liposuction and they get in the wrong plane and they puncture the liver. There's been reports of people puncturing the heart with a lipocannula, and that could be it. I think that's much less likely, although it is a possibility. All right, what about the doctor facility? Well, there was really no details, except they did say it was at a private clinic. I don't like that. I don't like surgery like that done in an office setting. I will say there are some excellent surgeons in the United States that have their own personal ORs that are very, very safe. But there is that absence of oversight and regulation. Yep. If I want to do something in the surgery center that's not safe, someone's going to call me out on it. They're not going to just let me do it. They're not going to let me not call 911 or initiate a code if a patient's having.
It's kind of like meeting somebody in public,
Right, there's people around. Like you're not going to try and do something shady. Yeah. Because if it's your private clinic, operating theater or whatever, the people in there work for you. Like you have control over them. Versus in the OR, nobody there works for me.
There's no
anesthesia is
oversight.
Independent.
Yep.
The circulating nurse is independent, and the scrub is independent. So like, if I'm going to do something totally stupid, they're going to like sound an alarm, and they're not going to let me do it. You don't have oversight like that in a private clinic. Also like as far as sterility and all that, where there's regulation, none of that exists.
Yeah.
So
exactly.
So there was a lot that happened here that I didn't like. I kind of call it the trifecta of serious plastic surgery risk, which is medical tourism, getting a Brazilian butt lift, and big surgery in an office-based setting.
Yeah.
And it's like when you start adding risk, eventually it catches up to you, right? If you do one thing that's risky, okay, maybe get away with it. But when you start stacking these risks, eventually you're making it to where it's it goes from extremely unlikely to, hey, this is a possibility, and then something happens.
Right. Yeah. No. Absolutely. It's one of those things, you get what you pay for, and I wouldn't say in medicine cheaper is always better. You don't want to go for.
Yeah. You don't want to like your surgeon to be like the one that's the lowest bidder.
Yeah. Exactly.
Especially when there's no regulation of like who's doing what.
Yep. And there's enough out there. Surely, you ask. Hopefully, I don't know, do you have patients that'll ask about risk and, hey, what's the risk in this, or what, what can happen?
When I do a consult, that's part of my consult. It's like, these are the risks that I see. I'll even break down like how many I've seen. Because for a lot
before they even ask, you're telling them, hey, these are the issues that could come up.
So when I do a consult, I basically give an overview of the procedure, my general thoughts on it, how many I do, technically how it's done, any things you need to think about before you do it. So for example, if it's like, say, augmentation, like, okay, what size do you want to be? How the procedure's done, what's the recovery like, what are the instructions, and then what are the risks?
Right.
And that's for every surgery I do, I go through all that. It takes about 30 minutes,
Yeah.
But at the end of it, patients are like, geez, thanks. That was actually super informative. I feel like I kind of actually know what this is about.
You're answering questions they didn't know they had.
Right, yeah. So
awesome.
All right, last recap. Brenda, you ready? All right, I had a very, very sad segment I did today. I like to say that this is a trifecta of serious risk of bad outcome with plastic surgery. It included medical tourism, number 1, a Brazilian butt lift, number 2, and somebody getting major surgery in an office setting, number 3. There was this poor woman from the United Kingdom who was abroad in Costa Rica. She was a teacher there working at a bilingual school, decided to have liposuction of her arms, a tummy tuck, and fat grafting. We think that she probably got a Brazilian butt lift, which if you watch this show, you know I hate Brazilian butt lifts. It's just a very risky surgery. Unfortunately, she had complications during the surgery and passed away the next day. There's not a lot of details. We were kind of trying to figure out what maybe happened to her. I think fat grafting from the Brazilian butt lift is probably the most likely culprit. Because it was an office setting, it could have been an anesthetic issue. For example, if they did this under local anesthesia, which would be a super, super bad idea, there's the risk of local anesthesia toxicity. It is possible she actually had like a traumatic injury from the liposuction, but I think fat embolism from the Brazilian butt lift is the most likely culprit in this. Again, 3 things I don't like: medical tourism, Brazilian butt lift, and large surgery in an office-based setting. Each of those adds risk, and you add enough risk, and eventually those risks become true. So very sorry to hear about this poor lady, but hopefully people will see the segment and learn, that there are risks involved with surgery, and you got to be careful. So, all right, that's it.
Absolutely. Great
all right,
show.
buddy.
Good info.
Show. Brenna, any last minute questions?
This was great. I'm feeling educated, even though it's sad stuff, but.
Absolutely. Good stuff. You know what to do.
All right.
Yes.
Well, thanks, Brenna, for being here as always. Robert, thanks, buddy.
Absolutely.
Thanks for
always.
filling in.
Absolutely.
All right. Please leave us a like, leave us a comment, hit that subscribe button. If you have any topics you'd like us to talk about on the next episode of Nip Talk, let us know. We'll actually do them. So let us know. And we'll see you next week. Bye.